You're listening to the Agent Survival Guide podcast. Whether you're a seasoned agent or just starting out in the insurance industry, there's always something to learn. I'm your host, Tina Lamoureux. In this series, we're covering the essentials. There's one thing that the insurance industry loves, and that's acronyms. For clients, agents, and anyone involved in the health insurance industry, the sheer number of acronyms can be astounding. In this episode, we're focusing on the dates and definitions of Medicare enrollment periods. If you're an agent in the healthcare field, you will hear these acronyms often and should easily be able to define them. It's important to note that different lines of health insurance can have different dates and rules for enrollment periods, and these can change with new legislation. Compliance and regulations for Medicare, Medicaid, and the Affordable Care Act are always evolving, so it's key to stay up to date. A great way to stay up to date with industry news is by following this podcast. Back to Medicare enrollment periods. The 6 we're covering today are IEP, GEP, ICEP, AEP, SEP, MAOEP, and MedSup OEP. We'll start with the first enrollment period people aging into Medicare typically qualify for, IEP. This is the initial enrollment period. As someone gets closer to their 65th birthday and they meet certain criteria, they will become eligible to enroll in Original Medicare or Medicare Advantage. More on that second option soon. The standard IEP for someone aging into the Medicare program is a 7-month period that starts 3 months before that individual turns 65, includes the month of their birthday, and runs another 3 months after their birthday month. For those eligible for Medicare due to qualified disabilities or illness, their enrollment period starts 3 months before the 25th month of their disability benefit entitlement, includes the month of their 25th disability entitlement, and runs for another 3 months after their 25th disability entitlement. Just wanted to give some quick clarification on that last one. For those under 65 who qualify for Medicare, their enrollment period will center around the 25th month of disability benefit entitlement. For example, it would be the 25th month they have received Social Security disability insurance or supplemental security income. Let's go over some examples. Let's say your client's birthday is in June. During the year they turn 65, the client's IEP will start March 1st and end September 30th. For a client who becomes eligible for Medicare due to disability, let's say they will receive their 25th disability benefit entitlement in August. Their enrollment will start May 1st and end on November 30th of that year. If someone does not enroll during their initial enrollment period, IEP, they can still enroll in coverage during the GEP, General Enrollment Period, that runs from January 1st through March 31st. It's important to note that as of recording this episode, there is a penalty individuals may face if they wait to enroll in Medicare Parts A, B, and D after their IEP has ended. This penalty is not a one-time fee. It is a percentage of monthly premium for Parts A, B, and or D, depending on how long they waited to enroll in them. Some clients may not be aware of this penalty. Some may want to delay Medicare enrollment if they still have health coverage from an employer or through a family member. But it may be beneficial in the long run for them to enroll when they are first eligible for Medicare. Additionally, we mentioned that clients can enroll in Original Medicare or Medicare Advantage within their IEP. In order to trigger eligibility for Medicare Advantage, clients must first enroll in Original Medicare. Once enrolled in Parts A and B, the Initial Coverage Election Period, ICEP, begins, and it can run concurrently with their IEP. It is truly during the ICEP that a client can enroll in a Medicare Advantage plan. The ICEP is a 7 or 3-month enrollment period that centers around when the client enrolls in Part B. If the client signs up for Part B during their IEP, this period lasts 7 months. Starting 3 months before the individual turns 65, including the month of their birthday, and running 3 additional months after their birth month. If the client delays Part B enrollment, it will start 3 months before you enroll in Part B and ends the last day of the month before your Part B coverage starts. Remember, those who delay Part B enrollment can sign up during the GEP that runs January 1st through March 31st each year, or a special enrollment period, which we'll cover soon. For example, if a client's birthday is in July, and their Medicare coverage also begins that same July, this would make the client's ICEP from April to October. Moving on to the AEP, which stands for the Annual Enrollment Period. If you're in the Medicare field, this will be the busiest time of year for you. During AEP, those already enrolled in either Original Medicare or Medicare Advantage can switch insurance plans or carriers, go from Medicare Advantage to Original Medicare, or vice versa, or add, drop, or switch their drug coverage. AEP runs from October 15th to December 7th. If a client changes their coverage during AEP, the change will go into effect January 1st of the following year. Let's say a client utilizes their ICEP or the AEP to get a new MA plan, and February rolls around and they have buyer's remorse. That's when the MA OEP, Medicare Advantage Open Enrollment Period, comes into play. During this enrollment period, a client who enrolled in an MA plan during their ICEP gets a personal 3-month Medicare Advantage Open Enrollment Period. Their MA OEP begins the first month they become eligible for Medicare Part A and B. Individuals who enroll in new MA coverage during the AEP can also utilize the annual MA OEP, which runs from January 1st to March 31st, to switch their MA plan or go back to Original Medicare and pick up a drug plan on their return. A client may want to switch their coverage due to changes in circumstance or preferences. As an insurance agent, it's important to stay in touch with your clients and relay any plan changes they need to know about. There's another enrollment period for Medicare that you should keep in mind as you're getting started. This is the Medicare Supplement OEP, or MedSup OEP for short, also sometimes referred to as the Medigap Open Enrollment Period. A client is generally eligible for this enrollment period if they have Medicare Part B and are age 65 or older. This period spans 6 months, starting the first month a client meets the requirements. During this time, qualifying individuals can enroll in Medicare supplement policies without undergoing underwriting or be denied for having pre-existing conditions. The MedSup OEP, like the IEP, only happens once for a beneficiary. There may be opportunities to enroll in a MedSup plan later on, but individuals may be subject to underwriting, fewer options, or higher costs. Some states may allow for individuals under 65 who qualify for Medicare to enroll in Medicare supplements, but it is currently not federally required. When a client first becomes eligible, there are important dates and options for them. It's your job as an agent to educate them on the entire enrollment process and their options. Moving on to the last type of enrollment period we'll talk about: special enrollment periods. A special enrollment period is an enrollment opportunity typically triggered by an event or change in a client's situation. For example, if a client loses health coverage from their employer, if they are eligible for Medicare, this would create an SEP so they can enroll in Medicare. Other situations that may lead to an SEP include a client moving outside of their current plan's service area, a client's plan being changed or terminated, or a client becoming duly eligible for Medicare and Medicaid. These are just a few scenarios that can lead to a special window of time for enrolling in coverage. Agents spend a lot of time getting ready to sell for these enrollment periods. It may seem overwhelming at first, but more enrollment periods means more opportunities to make year-round sales. If you're new to the insurance industry, consider following our podcast. It's all in the name, the Agent Survival Guide podcast. We're here to help agents grow their business. If you have a question or there's an aspect of the health insurance industry you find confusing, don't hesitate to reach out to us. You can email us at asgpodcast@ritterim.com. That's asgpodcast@ritterim.com. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Tina Lamoureux. Script editing by Sarah Rupal and Roxanne Anderson. Podcast design by Urban Rivera. Rate and review our show on Apple or Spotify.